as well. So good morning to our local audience as well as our international audience. It's always a pleasure and it's always a joy for me to come on the air and talk about something in the preventive healthcare category. So we missed you the last couple of weeks.
Yeah, I was playing last week in Arkansas.
Arkansas, huh? So you played a little hooky on us, huh?
Well, not really hooky. It was work.
Oh, okay.
Yeah. And someone once said that Arkansas is the only state in the Bible. People wonder how is that when Noah looked out of the ark and saw.
Okay. You know, I have not so fond memories of Arkansas.
Oh, really?
I was last time I was in Arkansas, I was 16 years old, and I was on an elevator. I was at a science fair. I was chewing a piece of bubble gum, and a filling came out, and that was a Sunday morning.
Oh my goodness.
So I haven't had a piece of chewing gum in my mouth since, and that's my most memorable thing about being in Arkansas. I was actually in Little Rock.
Little Rock, okay.
But yeah, I was at a science fair and chewing some bubble gum, and bang, there went a filling coming out in the gum.
Wow, that wasn't a good feeling.
It was not, especially on a Sunday. There's no dentist available, so it was a little discomfort until the next day. Then I think I had to present that day too, my science project. So I'm sure Arkansas has some better memories than that to be had.
Yes.
I just so happens I haven't been back since that time that I can remember. It's not on the normal route for layover, an airplane, or anything like that. So I don't know that I've been by there for anything.
Okay.
But anyway, let's talk some preventive healthcare things. I thought we'd start off by talking about the Ebola virus again. It's so much in the news. Last week we talked about it a little bit, and for those of you who are live on the radio here locally, we're coming from 970 out of Ahoskie, and I'm coming to you from Down East Nursing Home, where I stop seeing patients for a few minutes and come on the air. But you can also join us on the World Wide Web, and you can watch it live. You can go to my website, askdrferguson.com. On the center of the page, you'll see live radio. Click on that link, and that'll take you to a YouTube site. Click on the little house in the top left-hand corner, and then click on Feed, and you'll be joining us live. And each week, we're having more and more people that are joining us, and we just welcome you to do that locally. And those of you who are visiting us with us nationally, and internationally, we encourage you to tell your friends about us so they can join us each week at 9:30 to 10 on Wednesday. And those that you don't catch the program live, you can always catch the rerun. We do archive them on the website, on the youtube.com/user/AskDrFerguson site. All the ones that we've done live on the radio, they are archived there. So that's another good resource for you. But we were talking about the Ebola virus a little bit last week and boosting your immune system. The Ebola virus presently is quite devastating in Western Africa. We've had 2 cases here in the U.S., but those 2 cases came from Western Africa. We have not had any cases in the U.S. that have come from somebody getting the disease here in the U.S. It comes from direct contact. It's not easily obtained, but it is direct contact, and so hand washing becomes critically important, that a person does a really good job in their hand washing, and they're doing that constantly and consistently. They've got kind of an unwritten rule right now going on in Western Africa where you stay 6 feet away from anybody and you don't shake anybody's hand. They report, I think I heard on the news either last night or this morning, they had 50 new cases yesterday. And right now there's about a 60 to 75% chance that they're going to die when they come down with the Ebola virus. So it's pretty significant. We don't have a vaccination for it. We've got some trial things that we're trying, and they're trying to rush those through. But right now, there's really no good treatment. It is carried by direct contact with bloody or body fluids. It's you got to get it from a person that's already infected, not just thinking they might have it. So you don't get it unless the person already has the infection. It's not a respiratory disease like the flu, so it doesn't transmit through the air. It can from contaminated food and water. They're thinking that you can get the illness from that way. And individuals that are coming down with the Ebola virus, and they're putting them on a quarantine, they're putting them on the isolation to try to keep it from spreading. But because the technology is not the same in Western Africa as it is here in the U.S., they're having a little trouble getting the message out into a lot of these communities, or maybe you might say villages, and so that's not helping the spread at all. But for those of you here in the United States, unless you're in contact with somebody who's recently been to Western Africa, the chance of you getting it is as little to none right now. We don't know of anybody that's contacted this disease in the United States, and they're trying to do a good job on people on flights that are in and out of that area. They're trying to have the appropriate quarantine, the appropriate information, so that people can do the right thing.
Yeah, when I go on, I always travel Delta, so I called them last night. They now through September, if everything is probably okay, but those who are uncomfortable with flying, they can get a refund and won't have any restrictions on changing the ticket.
Right.
But and to call back, traveling, call back to find out. But there have been some cases found in Nigeria, which is also part of West Africa.
Right.
So, to be very cautious about that before going.
Right, for sure. So when are you supposed to go back over there?
November.
November. Well, hopefully they'll have it in wraps by then, but the outliers could still be there, so you need to be on your P's and Q's.
Exactly.
No shaking hands, no close contact, all that kind of stuff. You're gonna have to be kind of standoffish.
Yeah, if that's the case, I won't go because during the church services, you can't always stay 6 feet away from people and not shake hands.
Yeah, and that's gonna be tough. That's the culture of a church service.
Exactly.
Close contact, shaking hands, touching, etc. So you want to be careful.
Amen to that.
As devastating as this disease is right now, even if they've got it under reasonable control, I still think it's going to be an issue by November.
Just as they say it by here.
Right. Yeah. I don't foresee any way that this is still not an issue by November, because the communication is just too limited.
Yeah.
So many people don't have the cell phones, the towers, the televisions, and because of that limited transfer of information, I think they're still going to be coming down with cases at that time.
Yes, indeed.
That's the most likely scenario. To get it eradicated, I think that's highly unlikely. It's even questionable whether they'll have it in check by that point. Definitely not. I don't see any foreseeable way that it's eradicated, but even to have it in check, I think is a question mark. So,
until now, I don't know if I've heard of it. I don't recall hearing of Ebola before, but it's quite kind of rough.
Yeah, whenever you get a new disease breakout that we don't have a vaccination or treatment for, you're behind the 8 ball for that much longer, because treatments you just can't manufacture them instantly. When you try to manufacture something, it takes time. You have to grow it, you have to multiply it, you want to be able to test it. A lot of times when something's going this rapid and this fast, you develop something that you don't even have time to test, and you just start utilizing it without knowing what the side effects might be. Because that will be a scenario where the benefits are outweighing the risks.
Are you aware of how that what it's coming from?
It's a virus, so anytime you have a virus, right now I don't know if we know what the origin of the Ebola virus is. We know it's transmitted via people. I don't think it's an issue with animals. Let's see, it started in Western Africa, Liberia, Guinea, Sierra Leone. Potential for spread is very high. Significant risks to people in the U.S. if they're in contact with those from overseas. It's a virus. It's referred to as a hemorrhagic virus or hemorrhage virus. It can cause fever, disease, because of headaches, joint pain, achiness, diarrhea, nausea, vomiting, stomach pain, abnormal bleeding. Appears 2 to 21 days after you've been exposed. It's transmitted direct contact via blood or bodily fluids. But I don't know what the origin is. I don't know where it started. I'm not sure of that question. I'll have to try to look that question up and see if we know the answer to where it started. A lot of times viruses, we have a very hard time pinpointing where it started. We were years before we tried to pinpoint where we think the AIDS virus started, and this could be just as difficult. But I don't know the answer to that question, and I'll have to try to find that answer for you.
That's something that crossed my mind.
Right. But again, it's viruses are many different kinds of viruses. So don't think just because one virus is less like another. You got many different types of viruses. But boosting your immune system, as we talked about some last week, is very important. How do you boost your immune system? Proper exercise, proper sleep, proper nutrition, proper water, half a gallon a day. If you're 150 pounds and sit around and watch television, provided you don't have any other kidney, heart problems. Good nutrition, trying to stay away from the fast food restaurants, chicken, fish, and turkey, baked, broiled, steamed, or grilled, using the Mediterranean diet as an outline of how to eat. If you go by my website at askdrferguson.com, look under frequently asked questions, there's an outline of the Mediterranean diet. So that's a good way to try to eat. Sleeping 8.3 hours per night is an important thing to do. Supplementation, vitamins and minerals can be very important. Garlic is one of those things we know that can help boost the immune system. I recommend 3,000 milligrams a day of allium. Allium is the active ingredient in garlic. You won't get enough eating the cloves. You'd have to eat a couple of solid cloves in order to get that much allium. So it's going to be hard to do it just by putting more garlic on your food. Other things that can help boost the immune system, any antioxidants like the vitamin C is a very strong antioxidant. Those help boost your immune system. The Findol, which is one of the homeopathic products I use, you can find that on my website at askdrferguson.com. It's called the Findol, and I use that for helping to boost the immune system, help fight against allergies, and anything that helps boost the immune system also is going to help fight against cancer. So any of these things that can help boost your immune system are the kind of things you want to do to be in a better position that if you do come down with anything, you're much more likely to come out ahead. And that's just kind of general information, not the Ebola virus in particular, because right now, even if you start out very healthy, the chance of you getting very sick and possibly even dying is still quite high. But you can imagine it's going to be higher if you don't start out healthy. If you have less reserve, anytime you're having diarrhea, constipation, not constipation, but diarrhea or nausea and vomiting, you need to replenish your body with the fluids you're losing. Things like Gatorade can work okay. If you go by my website, look up Loaz. That's also a sports nutrition drink that was actually developed at the MDM Cancer Institute for patients that were having nausea, vomiting, and diarrhea. And it gets in the system in 90 seconds. So that's a real powerful tool to put on your shelf and to have available for any bouts of nausea, vomiting, or diarrhea, because those are the kind of things that can take you downhill fast, particularly if you're already maybe elderly or maybe very young or maybe already sickly. When you get an electrolyte imbalance, which very quickly can occur when you're having nausea, vomiting, and diarrhea, replenishing that can be very helpful. I can tell you, I'm sure I kept my grandmother out of the hospital 5 or 6 times by using Loaz. As when a senior becomes dehydrated, they go downhill fast, and they begin to have other symptoms, confusion, sweats. I can remember a couple of times my grandmother, you picked up her limb, she was just like a dish rag. She was just as limp as she could be, and
Wow.
without something like Loaz that I could get into her system, that was gonna require hospitalization. We had a tea that we gave her to help move her bowels on a daily basis, and I use a lot of that. It's called Nature's Tea off my website. And I had my son give it to her, and she was supposed to soak it for 8 minutes. Well, he just put it in a cup and left it alone. So half an hour later, he gave it to her. She literally had diarrhea for 48 hours.
Oh,
I mean, every 6 minutes. So, we had the room covered in plastic, the bed covered in plastic, the bedside commode sitting next to her bed, but it was literally a battle. And with Loaz, and because she was still able to drink, we were able to keep her home and not put her to the hospital. So that's just one kudo for Loaz or sports nutrition drinks in general, but the advantage of Loaz, it gets into the system so quickly in 90 seconds.
And how is it spelled for those who are listening?
What's that?
How is it spelled for those who are listening?
It's L-O and then Z-O-W. And there'll be a dash there, and you can, if you go by my website, you look under sports nutrition, it'll be on sports nutrition. So go to AskDrFerguson.com, look under sports nutrition, you can find it there. For those of you who are local, you can stop by the office. We try to keep some in the office, particularly during sports season. So, you know, these young people are beginning to play their sports, and we want them to be able to maximize their abilities, and part of that is being well hydrated. So for all of you who have young people that are involved in sports, make sure you encourage them to drink plenty of water. Drink it before they go out on the field, drink it while they're on the field, and drink it when they get home. Now when you take things like Gatorade when you're out on the field, it's okay, but it's still going to take 25 to 40 minutes to get into your system. So essentially it's kind of like drinking water. About 25 to 40 minutes later, maybe by the time you're in the locker room, now you get a lot of boost to maybe feeling a little better. But staying hydrated is the key as opposed to trying to catch up. Once you're behind the 8 ball, it's hard to catch up. And that hydration goes the same thing along with those people who are working in factory jobs or working on the farm. Working any place where it's hot, you must drink water, Gatorade, those types of things throughout the day. Primarily, I would suggest water. If you're behind, then you can try the Gatorade. If you're sweating a lot, you can try the Gatorade. If you're not sweating a lot, I would suggest stay with the water. And you know, a lot of times the factory jobs, we have a lot of factory jobs in our area. Those of you who are working those factory jobs, make sure your company has water and Gatorade, you know, every corner, and make sure you're drinking it every corner. Don't worry about, well, I'm going to have to go to the bathroom more. Well, you might, but it would be better to be healthy and go to the bathroom to be sick and not go.
Yeah.
So that would be my advice to all of you there who are working in those different type of factories. I know there's several meat factories in our area, and I know in the past, one year I had like 3 or 4 people that came into the office with heat exhaustion, and heat exhaustion is going to lead to heat stroke. And those come on you very quickly and without any warning. You can be feeling fine 1 minute, and the next minute you're feeling faint, lightheaded, and you want to pass out. And so you don't want to ignore heat exhaustion, because again, the heat exhaustion can lead to heat stroke. And what's the treatment? You got to get cooled off. You got to get some fluid in you. Get out of that hot sun. Get out of that hot environment. Get into a cooler environment. And most times, if a person does those things, they'll be okay. Particularly if you catch it early. But if you're already behind the 8 ball, then by all means, that's the type of patient you should get them immediately to the emergency room so that they can get the IV fluids, they can get into a cool area, and try to keep them from progressing into a heat stroke, which you don't want to do. That's not something you want to be part of the program. But that's a real phenomenon, and this time of year, a lot of people get these challenges. I haven't actually seen any heat exhaustions this year that I can remember. So I think people are getting the word, and they're getting some understanding how to do some basic treatment on their own at home.
And I hope that your program has something to do with it.
Yeah, and I hope it has. And one of those benefits is to make sure you're drinking plenty of water. That's going to be helpful. And again, those of you we're always getting more people joining us on the international web, and those of you who are local who want to join us, you go to my website, AskDrFerguson.com. Click on the little house. Click on the little symbol that says Live Radio. Then click on the little house on the YouTube page, and then click on Feed. You'll be joining us live. You might want to turn your radio off if you do that, because there's about a 30-second delay, and you'll probably have a significant feedback. And also, always want to mention patients, because we're always seeing new patients in the office, so you can always make an appointment to see us in the office at 252-332-6484. And we're always happy to see new patients. We really enjoy working with hormone balancing, Alzheimer's disease, but family practice in general. Well, those are 2 areas that I really enjoy working with, and that's the Alzheimer's patient, and as well as the patient that has a hormone imbalance. And I only deal in natural hormone therapy. I'm not dealing in synthetic hormones, so that's a big difference. A lot of times when I mention the word hormone to people, they get a little frightened, they get a little nervous, they say, oh no, I can't do that. Well, we're not talking about the synthetics. I don't do any synthetics because I don't think they're the best thing for the patient. But I do think balancing your hormone becomes very important. It becomes very important in your sleep, your weight, headaches, irritability, painful periods, heavy periods, muscle strengthening, just irritability, just all kinds of depression, all kinds of areas can benefit from having your hormones in balance. Chronic fatigue syndrome, fibromyalgia, all of these things have a significant benefit to be had when hormones are balanced. Erectile dysfunction, low libido, both men and women. And what I have found over the years is that, not found, but it was always true, men and women have the same hormones. And a lot of times, but we have them in different proportions. But a lot of times, if I'm able to, I was able to correct hormonal issues in the females, then I started doing the same things for the males. And so having really good success in correcting things like depression and anxiety, weight issues in men just as easy as females by balancing their hormones. And not to mention erectile dysfunction, of which we have great success in that area, and we're patent pending in that area. So for those of you who are looking to see somebody that's in the preventive health care category, we're always happy to see new patients. And again, if you have questions you'd like us to talk about online, you can call the radio station, you can call the office, tell us what your question is, and we'll try to take that topic up, one of the weeks when we're talking. Those are important things, and I like for the audience to kind of guide our conversation sometimes. Many times I'm coming up with a topic, but a lot of times it's something that's happened in the office that particular week, and somebody will mention something to me, and then I'll guide the conversation based on that. And the other thing I just want to also mention, we also have a substance abuse clinic. And the substance abuse clinic is largely dealing with opioids. Right now we're not dealing with cocaine or alcohol in the substance abuse clinic, but we're having great success with opioid addiction. That would be the heroin, the Vicodin, the Percocets, the Roxys, the Lortabs. All of those things are considered opioids, the methadone, and having great success with getting people off of those different products with using a medicine called Suboxone, buprenorphine. And what it does is the buprenorphine binds to those same receptor sites that the narcotics bind to, but the buprenorphine binds tighter. So consequently, the person doesn't have the withdrawal symptoms, but they feel much better. And so we wean it down over a time period, depending on where we start, because depending on how it's going to long take to wean it back down to zero. And that's what we do. So we wean it down from wherever they start down to zero. And one of the requirements of my program is I have all my patients at the end, I tell them they got to give me a 10-second victory dance. Whether we do it on video, whether we do it behind a green screen, it's totally up to them, but that's a requirement. I got to have a 10-second victory dance.
Do they normally do it?
Yeah, they do it. They do it. And, by the time, you got to realize, by the time a person, gets weaned off of drugs and they get down to zero, not taking any drugs and not taking any Suboxone, they're usually pretty happy. And they've usually had some pretty remarkable life changes by the time they get down to that point. And so by the time they get there, they're usually pretty excited. Usually quite, not quite, but sometimes apprehensive about whether they're going to be able to stay clean or be successful. I've been doing drugs for 10 years. Is this going? How am I going to do when I'm done? And am I going to be okay? Am I going to feel sick? And one of the things I frequently have to go over with patients is trying to get them to understand the difference between anxiety and withdrawal, because they look the same. So by the time a person is getting near the end, we got them down to maybe 2 milligrams a day, maybe 1 milligrams a day. That anxiety is often kicking up, and it can look just like withdrawal. It could be headaches, could be night sweats, could be aching, could be chest discomfort, stomach discomfort, nausea, vomiting. They can look just alike. And so I have to try to get the patient to understand that, what you're experiencing is anxiety and not withdrawal. Because the first thing they want to think, it's not working. Oh, what am I going to do? I'm almost done with the medicine, and I don't want to be sick. The reason a person doesn't go and stop in the first place usually is because they don't want the withdrawal symptoms. And the withdrawal symptoms are pretty bad. And for those of you out there that have family members that have loved ones with addictions to drugs, alcohol and cocaine is going to be a similar pattern they take, but we don't presently have a good treatment for either of those. I think they're working on them though. But for those of you that have families that are addicted to narcotics, understand that they're not doing it because they want to. You have what's called tolerance, and when they're building a tolerance, that's when they want to. That's when they're, a lot of times they're doing it because they like the way it makes them feel. But sometimes people have become addicted because their doctor put them on medication when they had a broken leg or they had surgery or something like that. So one can become addicted for many, many different reasons. So I wouldn't think of yourself bad or think of somebody bad because they've become addicted to drugs. Your body craves it, and so once you've taken it for long enough, then you can't stop, because now you pass the tolerance stage. In a tolerance stage, you could stop at any time, but by the time you get to the addicted stage, you can't stop without having withdrawal symptoms. Now again, you could stop at any time in the tolerance stage, but you usually don't stop because you're liking it in that phase. You know, 9 times out of 10, the person's liking it, and not just because they're taking it for some kind of pain or something like that. But by the time you get to the addiction stage, now you can't stop without having withdrawal symptoms. And why don't people stop? Nobody wants to be sick. You know, night sweats, nausea, vomiting, seizure disorder, irritability, not able to think straight, the skin feels like it's crawling. And you know, the list goes on and on and on for what a withdrawal symptom might look like. And so for all of you out there who are telling your loved ones, why don't you just quit? Why don't you just quit? Why don't you just quit? Well, if it were that easy, I think many people would just quit. But it's not that easy. And the only way a person usually just quits that way is usually they end up in jail and they can't get access to the drugs or to the Suboxone. Short of that, rarely will a person quit on their own because the side effects are just too great. You know, I've had, you know, I can think of one patient off the top of my head that quit without, you know, doing something like Suboxone, but she went through about 3 weeks of just kind of living, you know, just awful. And she had a real strong family unit that was there helping her and had a strong support group, and she was taking other medications to try to combat some of the other things that happen when a person's withdrawing, but that would not be advisable, and most people would not be successful at such an endeavor. So that's a little about the Suboxone program. But if you want to know more about that, you can call my office, 252-332-6484. I'm always happy to take new patients in the Suboxone clinic or in our regular office, so where we do family practice. You can also go by the website, which would be AskDrFerguson.com. Lots of preventive healthcare things there, some links to some other preventive healthcare things. You can go by YouTube.com/user/AskDrFerguson. I've got over 170 videos there on different topics like Alzheimer's disease, substance abuse, hormone balancing, a lot of different topics. And I have what's called a passion cam. In my passion cam, I put my camera on the dashboard while I'm driving, and I just talk about something that I'm passionate about. And I have a lot of those. All of those are going to be something positive, and a lot of those are also on substance abuse and withdrawal. So if you're guiding or leading your loved ones to that website, you know, tell them don't forget about the passion camp.
Right. Yeah, 30 seconds.
I thought we were pretty near the end of time, so just want to remind people, don't forget to catch my wife, Talk Back Now with Patricia. She talks about something political, something current event, and I hear people, I never hear people talk about my program anymore. They always talk about hers now. So obviously they're enjoying, but she comes on 11 to 12 on Mondays and Wednesdays. On Friday she comes on 10 to 11. She's also got a book out. Go to Amazon.com and get her book. It's called Bookends with Patricia Ferguson. On that note, I want everybody to be blessed and have a wonderful day.
Be blessed.
All right, bye-bye. And those of you in our World Wide Web, again, I'll be a little slower. You can go by Amazon.com and you can click on, put in Patricia Ferguson's name, or you can put in Bookends, Poverty and Politics, for those of you who want to get a better handle on how those connect. Order her book. I think you'll be very happy to have it. It's largely a book of quotes, so it's really geared at people that do a lot of speaking or interacting with public groups, but it's good for anybody. But even it's going to be more superior for those that are interacting with public groups, because it has a lot of quotes in there that you just won't find anywhere that deal with poverty and public policy, which many times are not said in the same breath, because many times public policy does not do things that are going to help out poverty. So on that note, to all of you in our listening audience, thank you so much for coming. Tell your friends about us. Every Wednesday, 9:30 to 10. You catch us on the World Wide Web, right where you're catching us today, youtube.com/user/Ask Dr. Ferguson. Or if you go on my website, AskDrFerguson.com, click on the little, right in the center page, it says Live on Radio, and then click on Feed when you get to the YouTube site, and then click on click on the little house first, and then you click on the word Feed. And the little house will be in the top left-hand corner. So on that note,
Sorry, you need to the nurse's station.
be blessed and have a wonderful day. Bye-bye.